treatment of Parkinson's disease. So, what does treatment or management of Parkinson's disease look like? It's a very individualized approach. So this would be something that you're discussing with your physician and healthcare team. There's no kind of one size fits all. We're really looking at kind of how people are functioning with their day-to-day activities of living. What that means is just because someone's been given a diagnosis of Parkinson's doesn't mean that we're immediately jumping to starting medication. We're really looking for kind of, is the Parkinson's getting in the way of things that people want or need to do with their day-to-day lives? The management of Parkinson's is not just medication, and I know we'll be having some other sessions on some of the other aspects of management of Parkinson's, such as exercise. Our focus today will be on treatment of motor symptoms. We'll be talking a little bit about treatment of the non-motor symptoms. And one of the most important aspects, which you'll hear about more later, is physical therapy and exercise. Exercise is actually a treatment for Parkinson's, not just because we should all be exercising, but it's actually proven to slow progression of Parkinson's. And that's really important because medication does not slow progression of Parkinson's. And so when we take a step back and think about that, if someone's having symptoms of their Parkinson's that are getting in the way of their ability to exercise, which is really helping slow progression and treat the Parkinson's, then I want to make sure that they're on kind of the right medication to allow them to do that. When is it time to start medication? Again, this is very individual. So a diagnosis doesn't mean we're starting meds. However, I think a diagnosis is a good time to talk about things like exercising if someone's not doing that already. There's some evidence as well for a Mediterranean style diet. And so these sorts of counseling things are important as soon as a diagnosis is made. So we're thinking about when symptoms are affecting day-to-day life, for example, limiting ability to exercise or limiting ability to do day-to-day tasks. Our mainstay of medication is one that you may have heard of. So it's called levodopa-carbidopa. The old brand name for it is Sinemet, although it's only generic now, although some people still refer to it as Sinemet. This was a major breakthrough of Parkinson's treatment way back in the 1960s. We've been using this medication ever since then, so we have a long knowledge of how it works and what it can help, what it doesn't, potential side effects. The levodopa is actually a prodrug, and it's converted to dopamine in the brain. Dopamine is the chemical that's lacking in Parkinson's. So the brain is not producing enough dopamine. That's what leads to the symptoms of Parkinson's. And so the levodopa is actually helping replace this in the brain. That second part of the drug, carbidopa, is actually just a helper drug. So if you were to take levodopa, a lot of it would stay in the gut and never get to the brain. So carbidopa actually helps the levodopa get to the brain by preventing it being converted to dopamine in the gut. So it's just a helper medication, but they're always taken together. This is the most effective medication that we have for Parkinson's. And the safest. And we expect, with Parkinson's that everyone will eventually require kind of some form of dopamine replacement for their Parkinson's. So common question that I get asked, does levodopa slow down Parkinson's progression? And we touched on this a tiny bit already. Or, an alternative question, some people have heard that levodopa may actually be toxic to the brain and speeds up progression of Parkinson's. Actually, what we've been able to prove with different research studies is that it does neither of these things. So it does not speed up the progression of Parkinson's. It's not toxic, but it also does not slow down progression of Parkinson's. That puts it in a category of something called a symptomatic treatment. So it helps with the symptoms of Parkinson's, but it doesn't change progression of Parkinson's. Common side effects of this medication, particularly when we first start it, sometimes a little bit of nausea, stomach upset, bit of dizziness. It can rarely cause hallucinations. This is much more common in people who already have cognitive impairment as part of their condition. We don't expect hallucinations in someone who doesn't. These side effects can be kind of reduced or even avoided completely by increasing the medication quite slowly. And if you are having side effects, talking to your doctor is a good idea because there are other strategies we can do to get people past that initial kind of hump of side effects of medication. In general, when we think about all the medications that are prescribed for Parkinson's and other conditions, levodopa tends to be a very well-tolerated medication. As I said, some people have side effects at the beginning. For most people, we can get past that or use other strategies. Another common question I get asked in the clinic is either I've heard I should take the medication with food, or I've heard I should not take the medication with food. So that can be confusing. And the answer is, of course, it depends. We think about 80% of people with Parkinson's don't notice whether the medication works better or worse if they take it with food or without food. So that means 80% of people, it doesn't really matter whether they take it with food or without food. For about 20% of people, they may notice the medication doesn't work as well if they take it with protein. So generally, my strategy is to not borrow trouble. It can be a fair amount of work to move your medication away from food. And so usually I'm not suggesting someone give this a try unless we know that they are someone whose medication doesn't work as well when they take it with food. For people who are having a bit of nausea with the medication, actually taking it with some food can help limit that nausea. We think of symptoms of Parkinson's that get better with levodopa as so-called being levodopa responsive. And not all symptoms of Parkinson's necessarily get better with levodopa. So symptoms that we expect to get better with levodopa are motor symptoms, in particular, stiffness and slowness. Tremor can be much more variable. And so tremor may not respond to low doses of levodopa. Someone may need to take a higher dose to have their tremor respond, or tremor may actually not respond much at all to levodopa. So often if we're starting medication, I'm suggesting we're paying attention to other motor symptoms such as stiffness and slowness, as tremor may or may not be so responsive to medication. Interestingly, several of non-motor symptoms of Parkinson's can sometimes respond to medication as well. So this isn't necessarily always the case. Sometimes these symptoms need their own specific treatment other than levodopa, but sometimes people will notice that these sorts of things can get better on levodopa as well. Now, what if you start on medication and you've heard all these great things about what it's going to do for you, and what if you don't feel any different? That's really a good reason to talk to your doctor and healthcare team. They may need to review kind of the type of medication that you're on, the dose of medication, how you're taking it, other factors such as constipation or in gastrointestinal infections can actually limit how effective the medication is. So this really is something to review with your team. If you've heard much about sort of Parkinson's type medication, you may have heard people talking about the medication kicking in or someone having on time with it, or the wearing off after kind of a certain number of hours of the dose, and then people experiencing kind of off time where they feel like the medication is not working as well. So this can be something that some people experience with their levodopa. Now, is it a problem if you're not feeling that? If your physician's asking you, do you feel it kick in? Do you feel it wear off? If you don't feel it kick in or wear off, that's not actually a problem. That's actually very common early in Parkinson's. A lot of people will feel better on medication overall, but not necessarily better with each dose. And the reason why is there's sort of this therapeutic window in the brain where you're having good on time, you're feeling well with the Parkinson's, you're responding well to the medication. In early Parkinson's, the brain is still making some amount of dopamine, and so people may feel better overall on medication. But as we see in the curve here, the medication kind of kicks in, wears off, but you feel good kind of the whole time. You're not feeling off or stiff or slow or any of that in between doses. This is probably the most common, I think, myth or misbelief about medication out there. People have maybe heard that the medication stops working after 5 years. And so they wonder, I'm feeling okay right now. Things are not too bad. I wonder if I should be saving that medication for later. And that's not actually how it works. So if we think about sort of, again, that therapeutic window of kind of how people feel with their Parkinson's, that can be quite wide initially, where people feel quite good at varying levels of dopamine. As the disease progresses, that narrows over time. And that happens regardless of whether someone's on medication or not. So I would say to start with the fact that you have 5 good years of medication is a myth. Medication, how you feel on the medication may change over time, but that's more a function of kind of how the Parkinson's is changing over time. So we may need to make changes to help with that. But that's not because you only have 5 good years, and we have people doing very well on medication many years into their Parkinson's. If we think about kind of how this changes over time, you have ups and downs with the medication. Over time, some people may develop kind of this off feeling, so feeling like their meds wear off in between, or sometimes dyskinesias, which we'll talk about a little bit as well, kind of feeling extra movements. Michael J. Fox would be sort of a more extreme example of those. And this sort of transition with the medication, kind of kicking in, wearing off over time is something that happens, again, regardless of whether someone's on medication or not on medication, because the medication is not toxic. So what are those dyskinesias? That's kind of those rocking, writhing movements or extra movements. They are a function of Parkinson's, but they're also a function of age. So the younger someone is, when they develop Parkinson's, the more likely they are to develop these extra movements. So for example, Michael J. Fox had onset of his Parkinson's at age 29, which is very different than for most people with Parkinson's. The older someone is when they first develop Parkinson's, the less likely they are to ever have these movements. A lot of people who have some of these movements, they're quite mild, and actually they may not be bothered by them, and they may not even notice that they're happening. Dyskinesias kind of correlate best with having Parkinson's for a long time. So that's something that if you plan to keep living with your Parkinson's, we don't have much control over. The other thing they correlate with is higher individual doses of medication. So it's not how many years you've been on levodopa or other medications, really, it's kind of how high the individual doses. So because of this, we think, the potential for developing dyskinesias down the road is really not a reason to wait to start medication. We talked about that a little bit already. The brain is changing over time, and so sometimes people can develop these dyskinesias because of that. When we first start medication, we often think about 3 times a day dosing. So here we're kind of seeing, one dose, second dose, third dose. If people are having kind of peak dose dyskinesias and wearing off in between, what we may want to be doing is actually spreading the doses out throughout the day and taking more than 3 doses. And sometimes taking lower doses more often can be helpful to limit things like dyskinesias and to limit off times as well. You may hear about 2 different kinds of levodopa. So one is immediate release. It's often yellow. It often is scored in the middle, so you could break it in half. This is, for most of us, our mainstay of medication. It's a more reliable medication. It kind of kicks in more reliably. We have a good sense of how it works. The controlled release may be used in more individual cases. I use a fair bit of it, but for specific reasons. It is less reliable in terms of the speed at which it kicks in. It's a variable person to person, kind of how long it lasts. So not everyone gets longer kind of duration of the medication acting on the controlled release. And also it can be a little bit more likely for the medication to feel like it doesn't kick in and work. So you kind of take the medication, it never really feels like it works. That's a little bit more common with the controlled release. But we do use both of these in Parkinson's management. This is what I was getting to earlier, sometimes taking kind of smaller doses more often through the day or using other strategies to kind of get in that therapeutic window of feeling good can be helpful with medication over time. Now, what about other advanced therapies for Parkinson's? So one is deep brain stimulation. So this is kind of the surgery for Parkinson's. They open a hole in the skull and are putting electrodes deep into the brain, and then that can be stimulated kind of at different locations and different levels. And so that is more advanced therapy for Parkinson's. Obviously, if someone's on medication and working well, we don't jump to doing brain surgery, because although it's a very safe surgery, it certainly is riskier than just taking a medication. This is most helpful in smoothing out motor fluctuations. So we talk about some people kind of have those ups and downs with each dose over time with their Parkinson's. This can really help smooth out how people are feeling through the day. For the most part, most symptoms, we think of, how good people feel on a good dose of levodopa. That's how good they feel with surgery. So for any symptoms that are not responding to medication, I would say with the exception of tremor, we don't expect those symptoms to get better with brain surgery. So for example, if someone's having a lot of symptoms that are not responding to medication, that's not a reason to do brain surgery. We also know that it doesn't help kind of all the symptoms of Parkinson's, and there are some symptoms of Parkinson's that the surgery can actually make worse. And so if people are having trouble with balance or, swallowing, thinking in memory, then we're often not doing brain surgery because it can sometimes worsen those things as well. Another advanced therapy that you may have heard of is levodopa-carbidopa intestinal gel, or duodopa. This is kind of involving a peg tube into the gut and kind of being able to administer medication on a more continuous basis. Again, as you can imagine, it's not better than oral medication and it's more invasive, but it can help if we're really struggling with kind of ups and downs of orally taken medications by mouth. Now, the new kid on the block. So you may have heard about subcutaneous levodopa. So this is kind of like insulin pump style. There's a little cannula that goes into the skin, and you have kind of a cartridge of liquid medication that gets infused kind of at a particular rate that's needed for each person through the skin. And again, this is not better than oral medication. It just helps kind of the ups and downs. I expect because this is more invasive than taking medicines by mouth, but less invasive than kind of those peg tubes and stuff. So I expect if we need advanced therapies in a person, for example, who might not be a DBS candidate, I expect we'll be seeing more of this being used rather than the one through the kind of gastrointestinal tract. This comes with its own complications, as you might imagine. So just like something like constipation can limit how well someone absorbs a medication by mouth, people can develop nodules or infections or that kind of thing through the skin where the cannula is. The cannula needs to be changed quite frequently, as does the cartridge, so that can be hard. if the dexterity is affected with the Parkinson's. And so this comes with its own complications, and is really, again, a more invasive therapy that we're considering in people who are kind of more advanced with their Parkinson's, and we're still having a lot of motor fluctuations with optimal kind of medication by mouth therapy. Now, there are a whole host of other medications that can be used for Parkinson's. So the first one here kind of prevents some of the breakdown of levodopa. They're generally not used as monotherapy, meaning the only medication someone would be on with their Parkinson's. Kind of really all of these medications tend to be used as helper medications for people who are already on some form of levodopa. Dopamine agonists are another class of medication. The levodopa turns into dopamine. The dopamine agonists help the dopamine that's there work more effectively. There's a couple different versions of this, and one of which comes in a patch, which can help smooth out motor fluctuations. This comes with similar side effects to levodopa, but also a few other side effects. And so certainly these are things that are being carefully considered with yourself, your care partners, and your healthcare team. I would also add all of these other medications tend to be less effective than levodopa, and they do come with more potential side effects. So that's why they tend to be kind of helper add-on medications in particular situations. This is a medication that helps kind of keep the dopamine that the levodopa is giving in the brain for longer. It prevents the breakdown. And so it can kind of helps, again, smooth out some of those motor fluctuations. Amantadine is a medication that can help decrease dyskinesias, or those extra movements. It can come with its own set of side effects as well, so we're using it cautiously. Now, this is a question I get fairly frequently in the clinic. What about natural treatments for Parkinson's? We touched on already exercise, as well as Mediterranean-style diet is helping slow progression. So those are certainly natural treatments, but in terms of sort of natural substances, there is one. This is called Mucuna pruriens, or velvet bean. A small percentage of the weight of this plant is levodopa, actually. And so you can kind of process, extract the seeds, and get some form of levodopa. Interestingly, because this is a natural product rather than a drug, it's not regulated by, say, Health Canada or the FDA the same way a medication has to be. So if people are taking this, they're buying it as a supplement. When they give you a dose, right? Like one tablet or one scoop equals this much levodopa. When they've done testing to see how much levodopa is actually, in there, it ranges from, 6% of what was said is in the dose to 141% of what was said is in the dose. So really, really variable. And none of the compounds that they tested contained kind of 90 to 100%, 10%, so a really close approximation. So this gets really tricky to dose, because we don't really have a good sense of how much levodopa someone's getting. Compared to if we're prescribing a pill with levodopa, we know exactly how much is in it because it's regulated to have to include exactly that amount of medication. There's also no carbidopa in this, so the side effects that we talked about are the issues with kind of more of the levodopa getting broken down to dopamine in the gut and less of it getting to the brain. Potential for more kind of gastrointestinal side effects can happen as well. So to touch briefly on kind of treatment for some of the non-motor symptoms of Parkinson's, these are very, very common. Most people will have at least one, if not more, of what we call non-motor symptoms of Parkinson's. As we touched on a little bit already, these sometimes do get better on kind of levodopa and dopaminergic medications, but sometimes they don't, and they need their own treatment. Oftentimes, your family doctor or nurse practitioner can be very helpful in managing and helping treat these symptoms. For example, treating depression in Parkinson's is not significantly different than treating depression otherwise, and your family healthcare team does a lot of that, and so they can be really helpful with this as well. We think often that these are much less visible symptoms of Parkinson's. So for example, someone may have an obvious change to their walking or a tremor, and people may be able to look and see that something has changed with them. But often the non-motor symptoms of Parkinson's are kind of more hidden. And so they are things to think about. They are things, hopefully, that your team that are managing your Parkinson's are asking you about, but also things for you to kind of think about whether or not these are impacting your quality of life, because these can often be managed and treated as well. So if we talk about depression and anxiety in Parkinson's, about 50% will notice changes to mood. So this is really, really common. And it's not just, okay, people are feeling a little bit down because they got a diagnosis of Parkinson's. When we compare people with Parkinson's to people with other chronic health conditions, there's actually more changes with mood and anxiety. And so we think that the changes in the dopamine are actually having downstream effects on our changes or on our chemicals for mood and anxiety. And so oftentimes we may need specific treatment to help target these symptoms, as they can be a huge impactor on people's quality of life. This can be cognitive behavioral therapy type treatments, talk therapy, etc., or sometimes medications as well can be very helpful. Sleep disturbances are very common. Now, sleep disturbances are very common with aging in general. Unfortunately, we'll never sleep again the way we did as a teenager. But there are specific changes that can happen with Parkinson's. One is REM sleep behavior disorder. This is acting out of the dreams, punching, kicking, yelling while asleep. So often it's someone's partner or family member that notices this, not the person themselves. This can be dangerous and can cause injuries to either the person with Parkinson's or someone sleeping in the bed. And so this does often need specific treatment. First-line treatment for this is actually melatonin, and then there's prescription medications as well. Insomnia or difficulty with sleep is very common in the general population, but also in Parkinson's. Sometimes this needs changes in people's Parkinson's medication, and sometimes it needs kind of other specific treatments. For example, sleep apnea or other things that are causing poor sleep quality. The bladder can be a big problem overnight. So sometimes lifestyle modifications, decreasing fluids in that before bed can be helpful. For those who have a prostate, this can often be an issue that may need treatment as well. And then sometimes we do use specific medications to help with this. Constipation is very, very common in Parkinson's. So just as we think of a lot of body systems slowing down with Parkinson's and lack of dopamine, the same thing happens in the gut. And so for a lot of people with Parkinson's, they may be drinking lots of fluid, doing lots of exercise, having lots of fiber, and those are all important things, but they may or may not be enough to help keep the bowels moving. This is very important in Parkinson's, both to keep people comfortable and out of hospital with a bowel obstruction and all of that, but also to make the levodopa and other medications absorb effectively. So bad constipation can be one of the most common reasons that people aren't feeling much different on medication, or they're feeling like it's not working very well. Cognitive changes can be very common over time in Parkinson's. This is something that you'd want to talk with your care team with, and we often are doing formal testing to kind of see where people are at in the clinic. Exercise, again, likely helps slow down cognitive changes in Parkinson's and in general. There's lots of management strategies that you can talk about with your team about kind of how to deal with this. And then we do sometimes use medications as well to slow cognitive changes. Alternative therapies. So does something like cannabis help with Parkinson's symptoms? This is a good question I get fairly often in the clinic from patients or often family members. There's not really any good literature that cannabis is particularly helpful with Parkinson's. I've had a lot of people try it in particular for tremor because, as we mentioned, that's a symptom that can be less responsive to traditional medications. I've yet to have anyone come back and tell me that it was really helpful. There are also some kind of cautions that if someone wants to try something like cannabis that we might talk about. So for example, apathy and kind of low mood can be a problem in Parkinson's, and for some people, cannabis can make that worse. Um, some people can have trouble with cognitive changes or hallucinations in advanced Parkinson's, and sometimes cannabis can make that worse. I would say I do have some people who are using it for things like sleep or to stimulate appetite. Um, I think it's an important thing to talk about with your healthcare team so that they know kind of what you're using, how you're using it, and may be able to pinpoint any potential side effects. Just because it's a natural compound doesn't mean that it doesn't come with potential side effects. And similar to the natural levodopa that we talked about, there can also be some variability in kind of how much, CBD or THC you're actually getting in one gummy or a kind of drop of liquid or that kind of thing. Again, because it's a natural compound and therefore not regulated the same way as a medication. So this can add a degree of variability in day to day as well. All right, with that, that's all I wanted to chat about today, and I would be very happy to take questions.